We are back with another series. Let's revise PYQs. This will benefit you in your upcoming exam. Let's look at the first question from this video. Question 1. What type of study is being conducted to investigate the potential link between exposure to aniline dye and bladder cancer in workers who have been employed in the industry for more than 20 years? The study involves two groups. One group includes workers directly involved in handling the dye, while the other group consists of office clerks who are not directly exposed to the dye. The duration of occupation was recorded from available records. Your options are, and the correct answer is retrospective cohort study. Here's the explanation.
Let's try to understand. So now what I have to do is, why did retrospective cohort study come into place? Because now I need to save time, I need to save money, I need to do away with the problem of large sample size, minimize administrative problems at the same time. But at the same time, the cohort should be able to establish temporality, calculate incidence, and study multiple exposures. Those all things should be there, but we have to save time and money. So how can we do it? Now look what I'm drawing over here. Instead of starting at the present time and moving forward, what I can do is, I start the study at present time. Let's say in 2023. You're going to start your study at present time, but you're not going to move forward. What you do is, first step is, you start the study at the present time, but then you are going to move backwards. Okay? The second step is, first step is you start the study at the present time, and then you go retrospectively. Retrospectively means you go backwards. Okay, you move backwards. Okay, and what are you going to do? You go backwards or retrospectively and use historical data. What is this historical data? Means already collected data. That means you've come across an old college register of a medical college. Okay, and on the basis of that college register, your step 3 is you use historical data and you divide the cohort into, okay, like here example, you found, I'm writing it also so that you understand, you found a college register of medical students, okay, medical students who were admitted in a medical college in 2010. So based on that college register of medical students who were admitted in 2010, what do? You divide your cohort into two groups, which is exposed and non-exposed. Can you see? We are again comparing exposed and non-exposed. So what is my fourth step? That based on college register, okay, based on college register that we have found, based on college register, the study participants have been divided into exposed and non-exposed. Then you are going to compare this group only, exposed and non-exposed. Then again you come forward in time. Okay, so this is the fifth step, meaning after you've divided them into exposed and non-exposed, you again move what? Fifth step is you move forward in time. And what will you do after moving forward in time? You're going to determine the outcome at the time the study begins. Last step, what you're going to do? See, you're going to determine, this is the sixth step, diseased, non-diseased. Similarly, in the non-exposed group, diseased and non-diseased. So what was my sixth step, everybody? The sixth step was we determine the outcome when? We determine the outcome, okay, at the time the study begins. At the time the study begins. So what did we do? We did not start with the outcome. No, like we were doing in a case control. A question very clearly students ask is that what is the difference between a case control and a retrospective cohort? So see, in a case control, you start with diseased and non-diseased. You start with the outcome. But in a retrospective cohort, what are you doing? In a retrospective cohort, you determine the outcome at the time the study begins. Okay, आप outcome को, when do you determine the outcome? At the time the study begins. Okay, so look at this once again. The first step was, let me write it. Okay, you start the study at the present time. That's the first step. Then what you do, you just start. You will start at the present time. You will not go forward. You go backwards. Okay, you go backwards, or this is also known as you go retrospectively. Okay, third, or go retrospectively and use historical data. Historical data over here could mean like any old register, any population register, college register, whatever, interviews, whatever. Okay, and then you will, third step is, based on historical data, what you're doing, based on historical data, divide study participants into exposed and non-exposed group. Okay, divide study participants into exposed and non-exposed groups. Okay, fourth step, what are you going to do? You're going to compare exposed and non-exposed group. Okay, you're going to compare exposed and non-exposed group.
Question 2. The years of potential life lost could be attributed to. Your options are, and the correct answer is years lost due to premature death. Here's the explanation.
Years of potential life lost. Now, what is years of potential life lost? See, somebody was expected to live up to 75 years and the person died at 30 years. Okay, so years of potential life lost means premature death. Okay, it simply means premature death. Okay, example, you can say the arbitrary cutoff that has been taken, arbitrary cutoff in India that we have taken, okay, is that the person should survive up to 75 years. Okay, but now what happened? The person died at 30 years. So what is the, how many years of potential life lost? 75 minus 30 years. Okay, so 45 years of potential life lost.
Question 3. Open vial policy is accepted for. Your options are, and the correct answer is IPV. Here's the explanation.
Which vaccines follow open vial policy and which vaccines do not follow, obviously, right? So which vaccines follow open vial policy and which vaccines do not follow? So which vaccines follow open vial policy? So for this, what is your mnemonic? You just have to remember the liquid vaccines. So liquid vaccines was, okay, so the bigger answer to this is all the liquid vaccines. And what were the liquid vaccines, guys? The T-series vaccines. Okay, T-series vaccines plus liquid means PO, PIO, PO, drink. So liquid is drink. So in T-series vaccine, I just told you what are those? Hepatitis B, pentavalent, okay, pentavalent vaccine, DPT vaccine, TD vaccine. So all these T-series vaccine, they follow open vial policy plus PO. So what does P stand for, everybody? Like I just said, PCV, IPV, OPV. So you just have to remember that which vaccines follow open vial policy, the liquid vaccines, which are your T-series vaccines plus PO.
Question 4. Which of the following is an example of prospective screening? Your options are, and the correct answer is screening of immigrants for infectious diseases such as tuberculosis. Here's the explanation.
Prospective screening is also known as presumptive or predictive screening. Like you must know, high risk screening is the same as selective screening. Okay. Similarly, now what is prescriptive and prospective screening? So I'll just tell you. Prescriptive is like prescribing. Just remember, prescriptive screening is done for one's own benefit. Okay, screening for one's own benefit. Prospective screening is done for others' benefit, for better prospect. Now see, prescriptive, you can remember, drugs are prescribed to us for our own benefit. Similarly, screening is being done for our own benefit. Okay, so prescriptive screening is for one's own benefit. Prospective, you can remember, for better prospects, for better future. So this is for others' benefit. Okay, and prospective is also known as presumptive or predictive screening. Now in prescriptive screening, you must remember, it is for our own benefit to make an early diagnosis. So this is which level of prevention? Secondary level of prevention. But prospective screening is for other benefits, like we screen all the migrants, or we screen any person who comes with a travel history. For COVID, we were doing. So was it for that person's benefit? No, it was more for the benefit of the country where he was approaching, because he was a risk factor. So prospective screening, everybody, is primary level of prevention. Okay. The purpose of prescriptive screening is actually case identification. Okay, that is the purpose. All right. So the purpose of this is early case identification. And what is the purpose of prospective screening? This is more for health planning. Okay, or you could say, before health planning, this is more for control of disease. Okay, this is more is control of disease and health planning. Okay, control of disease and health planning. That is more purpose of a prospective screening. So that's the difference between prescriptive, prospective. Remember, prescriptive is like prescribing a drug. So the screening is done for my own benefit. Okay, example of prescriptive, like screening a neonate. Okay, screening a neonate for neonatal hypothyroidism. So this becomes what? A prescriptive screening. But prospective is like screening immigrants or screening migrant population. Now you have to screen migrant population for certain disease, not for their own benefit, but for the country's benefit. Now look at these examples. Screening neonate for neonatal hypothyroidism, deafness in children, blood glucose testing for diabetes mellitus, mammography for breast cancer, pap smear for cervical cancer, visual acuity for refractory errors. These are all prescriptive or prospective. These are all for the person's benefit. So these are examples of prescriptive screening. But screening of immigrants for infectious disease like TB, COVID, HIV screening for blood donation. I've gone to donate blood and I'm being screened for HIV. It's more than me, it's for the benefit of the person who's going to receive the blood. HIV screening in ANC cases. Now, is it not for the benefit of the mother? More than that, why do you screen a woman for HIV? To prevent mother-to-child transmission of HIV to the baby. So it's for the benefit of the baby. Health checkups for person working in food industry. Why should there be routine checkup? For the people who are eating from them. Okay, so it is for others' benefit. This is what prospective screening.
Question 5. What percentage of distribution is represented by one standard deviation in a normal curve? Your options are, and the correct answer is 68%. Here's the explanation.
This point of coincidence, mean is equal to median is equal to mode. So that means mean, median, mode all are lying on this green line. Okay. So mean plus minus 1 SD covers 68% of observations. That's one very important point. Point number 9, mean plus minus 2 SD covers, guys, 95% of observations. And point number 10, mean plus minus 3SD covers 99% observations. Remember this. Okay, so mean plus minus 1 SD means this. Okay, this is going to cover, they cover what? 68% observation.
Question 6. The patient presents with a clean-cut injury that is not torn. He mentions receiving a tetanus vaccination approximately 10 years ago. What is the appropriate course of action? Your options are, and the correct answer is single-dose tetanus toxoid. Here's the explanation.
There are 4 categories for tetanus management protocol. Okay, category A, B, C and D. Now A is somebody has received full immunization within 5 years. Okay. B is full immunization has been received more than 5 years ago but less than 10 years. What is category C? Full immunization has been received more than 10 years ago. And D, of course, is nothing is known. You've fallen, you don't know whether you were immunized or not, or you've never taken immunization. Either it's not known, okay, or you've never taken immunization. Then you can classify the wounds also as clean wound and unclean wound. So if somebody has received full immunization, I've just told you what is full immunization, okay? Within the past 5 years, only wound care in both clean and unclean wound has to be done. If the person has received full immunization more than 5 years ago but less than 10 years, within 10 years, whether it's clean or unclean, wound care has to be done and TT single dose has to be taken, okay, both in clean and unclean. You were immunized more than 5 years ago but less than 10 years, okay. So wound care plus TT single dose. But if you received full immunization more than 10 years ago, so now if it's a clean wound, wound care plus TT single dose. But if it's an unclean dose, now here where we are going to add both active and passive immunization. Wound care, TT single dose, and also we are giving human tetanus immunoglobulin. So what are we doing? We are adding both active as well as passive immunization. Okay, we've done wound care, we've added single dose of TT plus human tetanus immunoglobulin. So again, a question often comes, guys, is that for which diseases active and passive immunization can be given together? Rabies, yes. Diphtheria, yes. Okay, tetanus, here also you're giving active and passive immunization together. Alright, so pay attention to those things. Now, if the status is unknown, not known, never taken immunization. Okay, so if it is a clean wound, wound care plus complete course of TT, the one that we just discussed. And if it's unclean, then wound care, TT complete course, plus we are also going to add human tetanus immunoglobulin. This is actually very important. Other than like whatever we've studied for tetanus, most important is the management. Okay, so A category is full immunization within 5 years, B is more than 5 years but less than 10 years, C is more than 10 years ago you've taken full immunization, D is nothing is known, you don't remember, or you've never taken immunization. Then you're dividing it into clean and unclean wound. Okay, and accordingly we are going to manage. Remember, immunoglobulin is added. When is it added? Category C, when full immunization was received 10 years ago, that too in an unclean wound. Okay, and if status is unknown in both clean and unclean, we have to give TT complete course, but in unclean we'll also add immunoglobulin.
Question 7. What does it indicate if a pregnant woman who lives with her niece in the same household tests negative for serum antibodies against varicella after contracting the disease? Your options are, and the correct answer is she is susceptible to chicken pox. Here's the explanation.
Now come to this algorithm for diagnosis and management of varicella in pregnancy. So suppose the woman has been, this is an MCQ, a conceptual MCQ, okay? She has been exposed to varicella. So if you have a well-documented history of infection, reassure the patient that neither she nor her baby is at risk. If she's been exposed to the varicella virus, but she tells you that she has already suffered from chickenpox before, so you will she has antibodies in her body, so you'll reassure that neither she nor the baby is at risk. But if there is no documentation of natural infections, he says, I don't remember, many times it can happen, you will obtain a varicella zoster IgG serology. Okay, IgG, you always know, points to past infections. Okay, so if it is positive, you can reassure the patient. If you see IgG antibodies, that means she has been infected in the past, so she has antibodies to fight. Reassure. But if it is negative, after obtaining the IgG, you see there are no IgG antibodies, you will give prophylaxis with varicella zoster immunoglobulins. We'll be talking about passive immunization or acyclovir or valacyclovir. Okay, if no infection develops, you can reassure the patient. But if she goes on to develop, in spite of this, acute varicella, if it's a mild illness, you can treat again with oral acyclovir or varicella. Okay, if it is a severe illness, you will treat with IV acyclovir. And you're going to evaluate the baby which is born with ultrasound for signs of, you're going to evaluate the baby with ultrasound for any signs of infection. So what is most important, that if the mother gets infected, if she says she has been infected with chickenpox before, you don't need to worry, you can reassure. But if there's no documentation of any natural infection, you will do a IgG serology. If IgG serology is positive, good, you can reassure the patient. But if it is negative, you will give varicella zoster immunoglobulin. So one of the indication of varicella zoster immunoglobulin is pregnant woman whose IgG serology has come out to be negative. If she has gone on to, in spite of that, if no infection develops, good. But if infection develops, mild hai, oral acyclovir, and severe hai, IV acyclovir. Okay.
Question 8. In a rural area, it has been noticed that numerous farmers exhibit an abnormal walking pattern, known as crossed gait, and rely on a stick for assistance while standing and walking. The farmers' diet primarily consists of rice and pulses due to inadequate crop yield. The incorporation of which of the subsequent vitamins in their diet could have potentially averted this condition? Your options are, and the correct answer is vitamin C. Here's the explanation.
This is what amla, okay, or this is also known as Indian gooseberry. Now this again is a PYQ, very famous PYQ, that amla or Indian gooseberry is the richest source of vitamin C. Okay, this picture has also been asked. Guava is another rich source. Potato is the cheapest source. Okay, potato is the cheapest source of vitamin C. But which one is the richest source? It's amla or Indian gooseberries. And deficiency of this obviously leads to what is known as scurvy. Who had worked to discover scurvy, if you remember? James Lind. Okay, all right. Now you know that it leads to collagen synthesis, okay, which is a supporting matrix for the blood vessel tissues and all. So if that is deficient, okay, vitamin C is deficient, no support to the blood vessels, swollen and bleeding gums, subcutaneous bruising, bleeding into skin and joints, delayed wound healing, anemia, weakness. Okay.
Question 9. Which of the following recommendations was not made by the Chadha committee? Your options are, and the correct answer is 1 PHC for 50,000 population. Here's the explanation.
Chadha committee gave two important things. Okay, now Chadha, you can remember, he used to sleep in small clothes. So that is why he got bit by mosquito. So Chadha committee. Now Chadha committee, you can remember by, he proposed two very important things. Okay, he was targeting on malaria vigilance. Okay, malaria vigilance and also family planning activities. Okay, family planning activities. Basically, he was, you can remember it house, that Chadha, he slept in small clothes and so he got bit by mosquito. So he focused on National Malaria Eradication Program. Okay, he was focusing on National Malaria Eradication Program, or you could also say malaria control activities. Okay, malaria control activities. So in this, the concept of preparation of malarial slides was also proposed by him. So malaria vigilance. At the same time, he was targeting family planning activities. Okay, so what did he propose? He said that we should have family planning health assistance. Okay, family planning, health assistance. So what is happening over here? He is proposing two things. So that is why the third thing, like you can remember like this, that he was proposing malaria and family planning. So he said, please provide me with the basic health worker. So one basic health worker to be provided for every 10,000 population. Okay, so Chadda committee was focusing on malaria vigilance and family planning activity.
Question 10. In Sustainable Development Goal 3, the target 3.1 aims to reduce the maternal mortality ratio by 2030 to per 1 lakh live births. Your options are, and the correct answer is less than 70. Here's the explanation.
So there is one target 3.1 which says that we have to reduce maternal mortality ratio to less than 70 per 1 lakh live births.
Question 11. Which type of thermometer is employed to assess the low air velocity rather than the cooling efficiency of the air? Your options are, and the correct answer is Carta thermometer. Here's the explanation.
Now look at this. This is a red color narrow and thin bulb. Okay, this consists of a narrow and thin bulb. Also, how can you remember this? This is a red bulb. Okay, and what is the name of this? Carta thermometer. Okay, it is Carta thermometer. So who Carta matlab you can say a bite. Okay, so a red dog bites. Okay, a red dog bites. Kata. Okay, kata means bites. That's how you can remember, because you'll get this, you'll confuse this with a globe thermometer. Here there is a red dog which is biting. So it has a narrow and thin bulb. Kata thermometer nowadays is used to measure low air velocities. Okay, that's our priority. It is used to measure low air velocity, and it was also measuring cooling power of air. Okay, but when we spoke about cooling power of air, not very reliable estimates were provided. Okay, not very reliable estimates provided. Okay, so now it is like more reserved for low air velocity. Okay?
Question 12. What is the duration of the extended sickness benefit provided to an employee who has been diagnosed with TB? Your options are, and the correct answer is 2 years. Here's the explanation.
Extended sickness benefit. Okay, so extended sickness benefit is offered for 2 years. Okay, it's extended for 2 years at 80% of daily wages. At 80% of daily wages. Okay, so this is extended for 2 years. Now, most of the times, this extended sickness benefit is covering, okay, extended sickness benefit is offered for 34 diseases under this act. Okay, most importantly, they ask you examples like TB, leprosy, HIV, for certain cancers, for hemiplegia, for stroke, all these things, even for mental illnesses. Okay, but most important, they give you the example of TB.
Question 13. Which organization is responsible for vaccines, child health and nutrition, safe water and sanitation, quality education and skill building? Your options are, and the correct answer is UNICEF. Here's the explanation. The most important thing was it gave a campaign which was known as Gobi Triple F campaign. Okay, this is a very favorite MCQ of exams. Gobi Triple F campaign was given by. So for children, what is required by G? G means growth monitoring. Okay, O means ORS. B means breastfeeding. I means immunization. Okay, and what are the 3 F's that it is standing for? Okay, so if you talk about the 3 F, female literacy or education. The other F is family planning. This was added later, but we have to know them. And one more F is what? Food supplements. Question 14. Which of the following is the best level of prevention of breast cancer? Your options are, and the correct answer is early diagnosis and treatment. Here's the explanation.
Secondary prevention is being done for all these CA, cervix, breast cancer and all that by early diagnosis and treatment, right? Like mammography can be done for early diagnosis of breast cancers. Okay.
Question 15. As part of the school immunization program, which vaccine is administered to a 10-year-old student? Your options are. And the correct answer is TD vaccine. Here's the explanation.
10 and 16 years. 10 and 16 years. What are we giving, guys? TD1 and TD2, right? Tetanus, diphtheria 1. So,
Question 16. Which statement most accurately describes the criteria for initiating an urban community health center? Your options are. And the correct answer is should have a 100-bed facility in metro cities. Here's the explanation.
versus urban CHC in a non-metro city. So if you talk about an urban CHC in a metro city, it is present per 1 per 5 lakh population, everybody. Okay, it is present for 1 per 5 lakh population. And in a non-metro city, it is present for 1 per 2.5 lakh population. Okay, in a metro city it is present for 1 per 5 lakh population, in a non-metro city 1 per 2.5. Here I would like to tell you, here there is 30 to 50 beds. In a metro city there are 100.
Question 17. In an urban area in the state of Madhya Pradesh, a premigravida goes for institutional delivery after being motivated by an ASHA worker. What are the benefits they will receive, in terms of money in rupees, under the Janani Suraksha Yojana? Your options are. And the correct answer is 1000 for mother and 400 for ASHA. Here's the explanation.
All pregnant women delivering in government health centers. Now it is also in certain private organizations. So all pregnant women delivering here, and HPS, all BPL, SC, ST. Before that, let us look at ASHA package. Okay, so ASHA's package has to be less. So however, in rural areas, it is more than urban areas. So this is how much? 600 rupees. Rupees 600 she is going to get, and ASHA is going to get in urban areas rupees 400. Next, now incentive of the mother has to be more. So in low performing state, she gets the maximum rupees 1400. And in high performing state in rural areas, it is half of it, rupees 700. In urban areas, the mother will get a little less. So low performing state, rupees 1000, and high performing states in urban area, rupees 600.
Question 18. What is the vector that causes the occurrence of buboes in the community? Your options are. And the correct answer is Xenopsilla chepis. Here's the explanation.
The most common and the most efficient vector over here for plague, okay, is Xenopsilla. Very important, guys. Okay, Chiopsis. Xenopsilla chiopsis. Don't forget. Bubonic plague, the first point, remember, it's the most common form of plague. Okay. Second, incubation period is 2 to 7 days. Now what happens in this? In this you will see the formation of buboes. Okay, you will see the formation of buboes, mostly in groin area and the lower limb. So what is happening in this, I'll tell you. The flea bites on the lower limbs. Okay, the flea bites on the lower limbs. All right, and when it bites on the lower limbs, from there it travels to the lymph nodes. So it leads to formation of buboes. Okay, there's enlargement, it travels to the regional lymph nodes, okay, and starts replicating. So once it starts replicating to the lymph nodes, okay, it forms what? Buboes. All right, what does it form? This is important. Bubonic plague, it forms buboes, which are what? Swollen lymph glands. And where will you see these swollen lymph glands, everybody? Particularly these swollen lymph glands you will see in the groin areas and lower limb. So if you are asked bubonic plague, what is it characterized with? Formation of buboes. It's the most common form. All right.
Question 19. In the revised National Tuberculosis Control Program organization structure, which of the following centers is the furthest from the core? Your options are. And the correct answer is designated microscopy center. Here's the explanation.
So here we have Ministry of Health and Family Welfare. Below that comes the Central TB Division. Okay, so in the Central TB Division is posted a National TB Officer. Okay, National TB Officer. Then we have a State TB Division. So in this State TB Division, who is posted? A STO. STO is whom? State TB Officer. Okay, State TB Officer. Below that comes a District TB Division. So District TB Division, who's posted? District TB Division. Here we have a District TB Officer. Below that is something known as TU. Very, very important. Okay, this is Tuberculosis Unit. Okay, and below Tuberculosis Unit we have DMC. What is DMC? Designated Microscopy Center. Okay, Designated Microscopy Center. And below that we have peripheral units. So basically peripheral units, everybody, are the dot center. Okay, so we have dot center.
Question 20. Which statistical diagram represents the population change in a specific location from 1983 to 1989? Your options are. And the correct answer is component bar graph. Here's the explanation. It is a bar because it is a gap. And look, city X, city Y, city Z, we are representing the different blood groups. So blood groups are discrete variables, and what has happened over here, that in one bar only we have divided it into components. Can you see? So what is this? Component bar diagram. Okay, what is this? This is nothing but component bar diagram. Question 21. According to biomedical waste management protocols, what is the proper method of disposing a broken vaccine vial? Your options are. And the correct answer is puncture-proof blue bin. Here's the explanation. Blue bag. Now if you look at this, here we have glasswares or metallic body implant. Anything which is a glass, broken glass, ampules. Like if I ask you vaccine vial will go into blue color bag. Nothing is mentioned. If I ask you a vaccine vial which still has vaccine left in it, or it has been expired, or it did not follow the cold chain conditions, okay, so it has been discarded, that becomes a microbiology waste because it still contains vaccine. But if it's an empty vaccine vial, it's a glassware, so it will go into a blue bag. Any pathological slides, any glass slides, okay, they're going to go into blue bag because they are all glasswares. Metals mein nails, important is metallic body implants, scissors, okay. There also they ask you artificial pacemakers, so they are all body implants, they are going into blue color. Includes broken or discarded and contaminated glass. Question 22. The Pathanamthitta district of Kerala was affected by floods and the government distributed doxycycline tablets for prophylaxis. Which other chemical will be distributed along with it? Your options are. And the correct answer is malathion. Here's the explanation. Similarly, malathion again is anti-adult. Okay, malathion is also anti-adult. It is sprayed 900 metric tons per million population. This also has a residual effect of 6 to 8 weeks. Okay. Question 23. In order to evaluate the nutritional status of young children residing in rural and urban areas, a research study was conducted. The study revealed that out of the total sample, comprising 30 children from rural areas and 20 children from urban areas, a significant proportion were found to be malnourished. Based on this information, which of the following statistical significance tests would be the most suitable in this scenario? Your options are. And the correct answer is chi-square test. Here's the explanation. Test used to compare two qualitative data. So I've said qualitative, so obviously it should strike your mind that we have to use a non-parametric test. So paired t-test, unpaired t-test, ANOVA, all these are parametric. Which one will you use? Obviously chi-square test. Okay. Question 24. Which of the options below is the most sensitive indicator for evaluating the accessibility, usage, and efficacy of healthcare within a community? Your options are. And the correct answer is infant mortality rate. Here's the explanation.
Most important indicator of health status of a community, level of living of people, and effectiveness of NEET services is infant mortality rate. Please don't get confused. This is best indicator for health status of a community. And what is the current infant mortality rate? It is now 28 per 1000 live births.
Question 25. Sharp waste is disposed in? Your options are. And the correct answer is white bag. Here's the explanation.
Sharps and other metals, so this is going into white.
Don't forget to like and subscribe if you found the video interesting. See you in the next one.